You're 31 years old, you're not ovulating, PCOS, you're overweight. Okay, it's very, very hard to lose weight. Sooner or later, you're going to be able to lose weight, but by then your eggs might be older. I think we should do an IVF procedure now, and we do that while you're 31 so we can get your eggs before they get older, because the only impediment to your getting pregnant is going to be the age of your eggs. So we shouldn't hesitate to do the IVF now, retrieve your eggs, fertilize them, freeze the embryos, and then we've got these embryos ready to go. And now you, at your leisure, without any anxiety or rush, you can work on losing weight. And then when you're ready to get pregnant because you've lost weight and you feel good about it, we'll put the embryos in and you can have the baby. The BMA should not be a restriction. BMI. I mean, some people have BMIs that are really high. They're very overweight, and it's very difficult. They may even need to have a gastric sleeve operation to lose their weight. But we don't want to waste all that time now. We want to get your eggs now. And no matter how heavy you might be, we'll be able to get good quality eggs now by doing our mini IVF protocol, and we'll freeze the embryos, and then we'll work with you on either a proper weight loss program or bariatric surgery. But frankly, there are experts we can refer you to that really are incredibly good at helping people lose weight in a natural way. Really incredible experts that are very, very well known around the world that can help you even just on Zoom lose weight. But that's not the issue right now. Right now, we need to get your eggs. Now, I'll explain to you why mini IVF. You have a huge number of eggs, and that huge number of eggs is inhibiting your FSH secretion from your pituitary gland. And so you're not secreting a dominant, you're not recruiting a dominant follicle when you start menstruating. So you never recruit a dominant follicle, and therefore you don't ovulate, you have irregular cycles. And you'll have a huge number of eggs, I guarantee you that. So we have to do a proper mini IVF protocol, or IVF could be very dangerous and you could get terrible hyperstimulation syndrome. So we'll make certain that it's safe and you don't get any kind of dangerous hyperstimulation syndrome. But you ought to plan for doing IVF now. And then after that, with your young eggs, we got them safely frozen. Then we'll work with you on trying to lose weight. But frankly, if your BMI is only 30 or 31 or 32, you might just want to get pregnant anyway. That's safe. But if it's an excessive BMI that would make the pregnancy really difficult, then we'll work on losing the weight before we transfer the embryos.